Hello learners, I am Dr. Ruchika Kuba, Director School of Health Sciences and your course coordinator for this program on lifestyle and non-communicable diseases. Now, mental health is an essential part of our overall well-being, influencing how we think, feel and interact with the world around us. While mental health exists on a spectrum, mental illness can affect individuals in ways that require understanding, support, and appropriate interventions. Despite the advances in mental health awareness, stigma and misconceptions still remain, often preventing people from seeking help. Today, we have invited Dr. Om Sai Rameshvi, Professor of Psychiatry, Lady Hardinge Medical College, who will help us navigate the definitions, challenges, and solutions in the field of mental health. Through this discussion, we aim to clarify the key concepts, debunk the myths, and highlight the importance of early recognition and management of mental health conditions. Welcome to this session, Dr. Om Sai.
Namaskar.
Namaskar, sir. Now, can you please share what you would like to consider as the learning objectives to be achieved at the end of this session?
At the outset, I would like to thank the IGNO for giving me this opportunity to share some of my experiences on this particular pertinent topic, mental illnesses. After completing this course, the individuals would be understanding some of the important things, such as what are the basic concepts related to the mental illnesses, what are the various barriers which we have which are surrounding the mental illness, and what are the various conditions which are called as mental illnesses, and how they are identified and treated in general. We can discuss about these conditions today.
Now, to begin, before going into the details and types, can you just define what is mental health and what is mental illness?
Yes. So I think it is pertinent to understand what is mental health before going into the mental illnesses. So as we all know, health is a state of well-being, but we also would not stop there, and we will say that it is physical health, psychological health, mental health and social health. So the mental health itself is a state of mental well-being that enables people to cope with the stresses in life, realizes their abilities, learn well and work well and contributes to their community. I would like to emphasize on 3-4 aspects of this particular definition here. One is that the person who is able to cope well with the stressor, realizes his abilities and learn well, that is a student, work well who is working in an office, and contribute to the community. This is what is called as mental health. Whereas on the other hand, mental illnesses are basically a group of health conditions which are characterized by disturbances in thinking, emotion and behavior. These disturbances often result in distress or impairment in social, occupational, other important areas of functioning.
That's a great explanation, and I think very important to begin with, from mental health to mental disease or mental illness. Now, given its impact, how common are the mental illnesses in India and also outside the world?
That's a very important question which you have asked, madam, because the very reason why we should discuss about this topic is that the prevalence is increasing, as I said, and it is because of the fast-paced world wherein we have a lot of stress amongst the young population these days. So the stress is more and social isolation is increasing, and a lot of pressures and a lot of digital dependency which is being seen in this recent past. So therefore, these are some reasons why the prevalence is increasing. And we also have seen that any particular group of demographic factors such as age, gender, socioeconomic status, they are not immune to have psychiatric problems. Anybody can have. And also we witnessed pandemic in the recent past, that is COVID-19. That also has seen very unexpected exacerbation in the mental health problems globally as well as in Indian setup. And the other important thing is that as we have identified the treatment gap, that is the people are not reaching the the available services. If we create more awareness, and if we increase the awareness, probably more and more people will be benefited by the treatment options available.
There is a lot of prevalence, you said, a lot of cases are happening, there are a lot of undiagnosed people, but there is still a lot of stigma around mental illness. Now, what are the various types of stigmas that we have, and what are its harmful effects?
Very correct. So the mental illness and its stigma is a major challenge which we are all facing currently. And if I have to categorize the various types of stigma, I would say that something originating from the self, that is individual. So the individual would be thinking that I am not fit, I am incompetent, I am not intelligent, so therefore I am having this mental illness. The person will be thinking like that, which will be leading to a lot of low self-esteem, and then he would not be able to participate as meaningful in the society. Then there is some problem at the community level also. So the people at the community level also will be labeling somebody as dangerous people, incompetent people, they will not be fit to the work, which leads to the situation wherein they are not being employed and they are not being rented house. I mean, somebody who approaches for the house, if somebody is known to have some psychiatric problem, so they will not be given the house. This kind of stigma is there. And there is systematic, that is structural stigma also is there, wherein when we have when we see I'll give an example. Health would be given certain fund allocation, and if you see carefully, only less than 0.5% of the fund which is being allocated to the health will come to the mental health. So therefore, less importance is given to the mental health, and which leads to a lot of issues, like they would not be sticking on to the treatment plan, and more stigma will come about the self, and they will be losing the hope, and they will not be able to perform well in the work situations, and they will have difficulty in developing some relationships, and which will be increasing the symptoms of the psychiatric problems.
Now, what strategies can help to combat this stigma?
Very correct.
Particularly in India, we are talking in the Indian context.
So it is important to discuss about how to combat the mental health stigma. There are many strategies which one can follow, but then some of them we can enlist here. One is that we should conduct large-scale public awareness campaigns across the country, various media platforms to be utilized to deal with misconceptions regarding the mental health, and the people should be educated about the different types of mental health conditions. And we should also conduct some programs in the school level itself. That is, we should utilize the school time when the child is getting trained, and also workplace and community, and also a lot of religious places can be utilized, and we should also communicate this fact that the mental illness is not because of the black magic, and it is just because of a mental illness which is also like any other illness. So if we can address these things at various levels, we can combat mental health to certain extent.
I think even the community leaders, if we talk about in the community, because
Correct.
They are the people who are really to whom
Absolutely.
all the people look up to, they listen. Also health workers, because they come and go house to house. Those are also two agents.
I agree with you, madam, that we can definitely be taking them into consideration as they are the stakeholders.
Among the list of important programs will be this session and our program on lifestyle and non-communicable diseases,
Yes,
which we are doing.
And another important thing is that how you communicate is also equally important. What is important is that you should discuss about the mental illnesses openly. You should not have any hesitation. As you can discuss about the diabetes, as you can discuss about your BP, you should be able to discuss about even mental illnesses. And you should also allow to share your lived experiences. Like when you had symptoms, what was your experience? When you came out of the symptoms, what has been improvised? So these are some things which can be discussed at various fora, even including the media, social media. And we should also normalize the discussions. You should not be giving lot of emphasis to the negativity of the symptoms. Rather, we should be able to discuss a bit more often. And then it should always be person first language which should be used. You should not use he is a depressed person, he is a schizophrenic person. Should not be used such kind of statements. You should use he is having schizophrenia, he is having depression. These are the better and accepted terminology. If we can utilize these things in our communication skills, it would be better. And of course, in healthcare system also we can make a lot of changes, and we can see that more and more trained people are available at various levels, especially at rural area. Probably we can reach more and more people, and we should also encourage the community participation, and we should create some support groups in the community so that they will be able to help each other. And we should also have some cultural considerations. If something is happening in locality, probably that can be utilized for communicating something about the mental illness. And probably the major issue, as I said, that less number of mental health professions are available currently. And if we can concentrate on that and then improvise the number of people available in our country, probably we will be able to combat the stigma in a better way.
That's really very insightful. Now, moving forward, can you also briefly just explain the major categories of mental illness, as you said, especially the mood disorders?
Yes, madam. There are so many kinds of mental illnesses which we can come across, and these mental illnesses are basically classified based on the symptoms and their causes and then treatment approaches which are available. But some of the common categories which we can enlist here are anxiety disorders, mood disorders, schizophrenia, and personality disorders, substance use disorder, neurodevelopmental disorders such as ADHD, attention deficit hyperactivity disorder, autism spectrum disorder, eating disorders like anorexia and bulimia nervosa. These are some of the kinds of the psychiatric illnesses which you can come across. And these things, generally clinicians will be diagnosing these things, and we have appropriate comprehensive treatment plans available for them. And if we help the person receive those things, he would definitely be improvised.
Okay, so since you said the most, after substance abuse, the most common are the mood disorders. What defines a disorder to be a mood disorder, and how really common they are?
Yes. So the mood disorders is the commonest psychiatric disorders which I just said now. And these are the group of mental health conditions characterized by severe and prolonged changes in the person's mood. Mood is basically how you feel. You feel sad, you feel low, you feel, disinterested. This is the mood. And the person would be feeling sad, and sometimes he would be crying, he would be, disinterested in surroundings. He would be presenting with, hopelessness, helplessness, worthlessness, suicidal thoughts. These are some symptoms of mood disorders when you come across. And there are different kinds of mood disorders you may come across. As one, depression, and there is something called as bipolar disorder. Then there is something called as cyclothymic disorder. Bipolar disorder is something where a person would be having alternatively depression as well as mania. On one hand, the person will be feeling very low. At that time, the same person will be energetic, talking too much, and spending too much of money, and thinking himself very big about himself. So these are some symptoms of manic features which you come across. And if you come to the figures, recent report of WHO says that there are 280 million people globally making the diagnosis of depression currently. And in our NMH survey, which recently conducted, says that 5% of the population are having mood disorders.
Mood disorders, you
Yes.
said, are also linked to suicide.
Correct.
Are there any documented numbers?
Yes. So, for example, in 2022, National Crime Records Bureau reported that there were 1,65,000 people who committed suicide in India, which is a huge number. And what is important to note here is that majority of them, or some of them, were also having psychiatric disorders, and majority of them were having depression. So therefore, we definitely, it warrants immediate attention, and we should be able to come out with some strategies.
Now, are there some individuals who are at a greater risk of developing these mental illnesses? And how can, or are there some factors which protect them from getting, the mental illness?
Yes, like any other illness, physical illness or psychiatric illness, mental illness, there are certain risk factors and protective factors for all these conditions. I mean, when it comes to the risk factors, it could be a family history, like we call them as genetic factors. Suppose if somebody in the family have had similar kind of disorders, psychiatric problems, the offsprings are more prone to have psychiatric problems. And then if somebody is having environmental stresses such as major life changes or chronic stressor, or maybe somebody who has experienced some trauma, abuse, neglect in childhood, are more prone to have psychiatric problems. And then somebody who is living alone, in isolation, there is no social support, there is no family support, they are more prone to have these kind of problems. And then lastly, the substance abuse is the major issue. I mean, somebody who is taking alcohol or other drugs are more prone to have psychiatric problems. On other hand, you also have a lot of protective factors. Suppose if you have good social support, and if you are realizing about the symptoms immediately, and you have gone for early identification and early intervention has been started, and if you are sticking on to the medication, these are some protective factors.
Now, are there some factors that can be considered as the causative factors which may be
Yes.
causing such kinds of diseases?
Yes, madam. As this is a very common for most of the psychiatric illnesses, not particularly to the mood disorders, but this particular model, which is called as biopsychosocial model, which means there are certain biological factors, there are some psychological factors, and there are some social factors. Biological factors meaning genetic factors, that is, as we just now said, that there are somebody in the family had similar kind of problem, and there are some neurochemical factors which are influencing, such as some imbalances in the serotonin or dopamine, which also would be the factor which would be causing the
That means some hormones which may be secreted in the brain.
Very correct.
Of such
These are some of the hormones,
Okay.
also called as some the neurotransmitters, which are responsible. And then there could be social factors in the form of chronic stress, work pressures, or bullying, or somebody is been targeted, the traumatic experiences. These are some poverty, the unemployment. These are the factors which would also be contributing.
I think this is something very important and revealing that you have told.
Correct.
And because often what happens in a family, if you find somebody is depressed or somebody is in an anxiety state, we don't really consider it as a disease and we blame the person. We tell them that you really don't know how to take life in the stride, or you really can't take any stress. We don't realize that there can be certain genetic reasons, there can also be certain chemical reasons, as you said, that their brains do not produce those particular kind of chemicals.
Very correct.
So that is very important for everybody to understand, I think.
Time and again, we all should tell ourselves that there has to be something called as medical model approach, meaning that any illness, including psychiatric illness, is basically an illness, and it has to be diagnosed, it has to be treated like any other physical illnesses.
Okay.
And when it comes to the treatment of the mood disorders, there are very clear identified medications which are available for the mood disorders, and in addition to the medication, they are also advised to undergo some psychotherapeutic sessions, wherein the mental health professional will be providing counseling sessions, and most importantly, they are also suggested to make some changes in their lifestyles, including regular exercise, proper nutrition, and social support and mindfulness practices such as yoga. These days we do talk about yoga and meditation very often, and there is something called as mindful based stress reduction therapy which is available for the persons who are having mood disorders.
Yeah, I think this is a very important thing, and I think in the subsequent sessions we will be talking more in detail how these various lifestyle changes, whether it is diet, whether it is physical exercise, how it actually scientifically helps to reduce and also prevent so many mental disorders. Now, moving on, anxiety disorders are another very important group of mental health, and you have just now said that anxiety may not be just a trait, may not be just a personality, but it could be a disease. So how can you define that it is not just an anxious person, but it is an anxiety disease or a disorder? How do you actually define it?
Very correct. So as just now we said, the common mental illnesses like depression and anxiety are really the major challenges which the population is facing currently. And this particular group of anxiety disorders are a group of mental health conditions. They are characterized by excessive worry. They are stressed and they are worried, they are being preoccupied, and they can have two kinds of symptoms. One could be physical symptoms, another could be psychological symptoms. Physical symptoms could be that they will be having the palpitations and sweatings, dizziness and difficulty in breathing, and as well as on other hand they can also have psychological symptoms wherein they will be having sense of impending doom or irrational fears. These are the some symptoms of anxiety disorder. There are so many varieties of anxiety disorders you may come across, starting from generalized anxiety disorder, panic disorder, social anxiety disorder, specific phobias. Suppose if you have to see very carefully, the generalized anxiety disorder will be characterized by persistent worry. I mean, most of the time, of most of the days, the person would be very much worried and stressed and restless, and they will not be able to concentrate. On other hand, somebody who is having panic disorder will be having episodic symptoms such as sudden onset of symptoms, overwhelming fear, and discomfort with physical symptoms such as chest pain, shortness of breath, and impending doom. And there is some other category, what is called a social anxiety disorder, wherein the person will be having fear of social situations. He cannot participate in the stage activities. He cannot talk to the people. He cannot meet people. He cannot participate well in the meetings. And then there are some specific phobias also which are seen, which are very specific to particular objects or particular situation, such as somebody can have fear of heights, somebody can have fear of spiders, somebody can have fear of cockroaches. So these are the varieties of anxiety disorders we come across.
That's very important, I think, because as you mentioned that there are also changes in the body which happen. Like in the panic disorder, I was listening that you said that there can be, chest pain, there can be increase in the blood pressure or increase in the respiratory rate or even the pulse. So that means that we don't have to take this very lightly, and we must seek immediate medical help for these particular disorders, get them diagnosed and get them treated.
Like, good thing is that there are very good treatment options available currently, such as medication, such as counseling therapies, such as lifestyle changes. So it is a comprehensive multimodal kind of management strategy which is offered to these guys, and it should not be taken easy. I mean, it should not be taken lighter, and they should be seeking help immediately, and they should be getting benefited.
So we've spoken about the mood disorders. Is there any other condition which is common in the country, not so easily diagnosed or detected, especially from people who are not from the medical background?
So there is something called as the schizophrenia, which is again a mental illness. It is a chronic condition. It is a severe mental health disorder, and you do come across people having this condition quite often, and which is basically characterized by, importantly, the disturbances in thinking, perception and behavior. And it involves, basically the person would be having delusions and hallucinations, disorganized thinking and disorganized functioning. Basically, just to give one or two examples, the delusions are the one where the person would be thinking that he's been targeted by the family members, he's been targeted by others, and he would be thinking that somebody is spying him, somebody is observing him. They will be hearing voices which are not being heard by others. They will be seeing something which is not being seen by others, and they will be behaving abnormally. They will be disorganized in the sense they will not be taking care of self-care. They will not take bath. They will not change the clothes. So these are the hardcore symptoms of schizophrenia which you come across. And this particular condition is almost like 1 to 1.5% of general population would be having schizophrenia, which is a huge number. And these are the people who would be having the symptoms for a longer time. And again, when you look into this, the model of etiology which we just now discussed for any psychiatric illness, the biopsychosocial model, which tells us that there are some genetic factors, there are some biological factors, there are some environmental factors.
So there is always a curiosity about the nature and features of personality disorders. As we are knowing now, what are the common personality disorders? Are there really something called personality disorders?
Yes. So the personality disorders again are a separate group of disorders which are slightly different from other mental illnesses, which are enduring patterns, meaning from the beginning of the developmental period to the later adulthood, the person would be having very particular pattern of behavior, particular attitude, particular thinking pattern, cognition, inner experiences that is little deviant from the other people, and they are little not accepted by the other population. So therefore they are called as personality disorders. And it is very important to know that it is a common group of disorders, are almost at, affecting almost 10 to 15% of people will be having this kind of disorders. And common personality disorders which you come across are basically antisocial personality disorder, narcissistic personality disorder, borderline personality disorder, avoidant personality disorder. Now basically these disorders will be warranting long-term help, in the sense they need to be requested to come for the counseling sessions on a regular basis, on a long-term basis, and they will be called along with their family members, and they will be provided the therapies.
And now, talking about the mental health issues in children, what are the types and features of various neurodevelopmental disorders, and what are these neurodevelopmental disorders? How can they affect the child or the adolescent functioning?
Yeah. So the neurodevelopmental disorders, by name itself, it is very clearly mentioned that it is a neurodevelopmental, meaning it occurs during the developmental period and it is pertaining to the nervous system. So there are so many categories of neurodevelopmental disorders which you can see in the children, but the commonest are intellectual disability, autism spectrum disorders, attention deficit hyperactivity disorder. Now there are current figures are so alarming that these numbers are increasing alarmingly across the world, including in India. Suppose if you come across about the numbers of the autism spectrum disorders, Center for Disease Control reported recently that approximately 1 in 36 children are having autism spectrum disorders. And in Indian figures and reports, if you see, almost 3 to 5% of children with children in the age group of 3 to 5, you will be finding attention deficit hyperactivity disorder. Now, these particular disorders are basically a cluster of symptoms. For example, in a child with autism, the child will be having difficulty in communication. They will be having poor eye contact. They will be having some stereotypy behavior. They will not be able to mingle with other children. They will not be having friends. On contrary, somebody who is having intellectual disability, the child will not be able to understand the basics, and they will not be able to do well with the studies. They will have difficulty in coping skills. And on contrary, ADHD, attention deficit hyperactivity disorder, child would be having inattention, not able to sit at one place, becoming very restless.
Again, this is a disorder which is just taken for granted that the child is very hyperactive. It is not considered as a disorder.
But it is essential to delineate and identify whether the child is having ADHD or not. One should not simply consider that it is just a hyperactive child, but you should also see whether it is having other symptoms of ADHD or not. And the reason why we should discuss about all these things and why everybody should consider is that wonderful pharmacotherapeutic agents are available for this kind of conditions such as ADHD, and the children are benefited enormously and their lifestyle, quality of life will be improved drastically.
Do you have any take-home message for our viewers?
Very, very true, madam. Globally, 1 in 8 persons would be having mental illness, and mental illnesses are a group of mental conditions characterized by disturbances in thinking, feeling and behavior, as I said initially. And mental illnesses are growing public health concern. We should note this. And the impact is seen in individuals' personal, interpersonal and socio-occupational domains. Early intervention, early identification, comprehensive management strategies can treat the mental illnesses. And strategies to combat the stigma around the mental illness and promoting positive mental health are the mainstay of the way forward. Thank you very much.
Thank you so much, sir. You have given so insightful information, and I think just to stress what you have said is that everyone should recognize that mental illnesses are actually present, and all the people who are actually behaving not normally may be having some mental illness,
Yeah.
and it should be recognized and treated.
Thank
Thank you so much,
Thank
sir.
you.
Thank
Thank
you.
you.